Whoops, forgive me. Go back. Again, just another nice color view. We can see all the different bones of the hand, anterior and posterior. Notice hook of the hamate, pisiform, not as easy to see from that posterior view. All right, injuries of the wrist, hand, and fingers. First up, we have a Coles fracture. Coles fracture is just a fracture to the distal radius. We see these with a fall. Hallmark, we get kind of this swan or this gooseneck deformity. Okay, so very, very common as a result of a fall. Scaphoid fractures. Main idea with the scaphoid fracture, very, very slow to heal because they have poor blood supply. Okay, so in addition, when we see a fall, so that Fuchs type mechanism, if we don't have a Coles fracture down here at the radius, we can also have a scaphoid fracture where it basically gets kind of caught between your carpals and the radius and bangs, and we see that where it almost snaps in half. Okay, so we see this as compression with a fall, but very, very slow to heal because of that poor blood supply. With scaphoid fractures, important to remember, x-rays aren't as great to find a scaphoid fracture. There's a lot of soft tissue, the anatomical snuff box that covers, so an MRI actually works better. And anytime we have displacement, we're going to need surgery for that scaphoid fracture. So it is a very, very important carpal and has to be managed as such. Hamate fractures we see as a result with clubs or bats. And what we have is the vibration can actually break off that hook of the hamate. Very, very common in baseball, softball. Lunate dislocation. Remember, our lunate sits right in the middle, and it kind of forms, it's a placeholder. It gives our carpal structure. And so we'll see anytime we have a fall or maybe get stepped on, that lunate can actually dislocate and it pops up. That causes the other carpals to collapse in on themselves. Okay, so the capsules kind of fall inward. If it continues to dislocate, oftentimes we'll have surgery. Wrist sprains, we've all suffered a wrist sprain. This is just categorized by the achiness of the wrist. Okay, so ulnar radial deviation, it hurts. Flexion, extension hurts. They might have trouble grasping. A great thing to keep in mind with a wrist sprain, simply put them in a brace. Okay, splint it, brace it. Very easy to manage that wrist sprain. All right, now back to TFCC. Remember, with TFCC, it's our shock absorber. Okay, anytime we have somebody that uses their wrist a tremendous amount, think baseball, softball catchers. Another at-risk population, gymnasts. All right, with how much they're landing and how much they're putting pressure on that space. Someone with TFCC will have a clicking or a catching. Okay, hallmark is going to be clicking or a catching. Specifically, look for that movement from wrist flexion to extension. You'll have that clicking or that catching. TFCC, it appears, it mimics a wrist sprain. Wrist sprains resolve in about 10 days, maybe 2 weeks. TFCC lingers. Okay, the pain, the clicking, the catching that you might have initially diagnosed as a wrist sprain does not get better. Okay, now we have to have an MRI. Surgery is going to be the best option. They go in just like a meniscus. They'll clean it up, typically 6 to 8 weeks for TFCC. All right, so anytime you have an athlete with long-standing chronic catching, chronic clicking in the wrist, think TFCC. Metacarpal fractures. You can get lots of fun ones. Okay, lots of cool, lots of interesting fractures. Lots of unique things that we can see with the metacarpal. You might have some finger displacement, finger issues. Let's go through a couple of them. Bennett's fracture. All right, just be aware, base of the first. Okay, Bennett's fracture, base of the first. Boxer's fracture is the fifth. Okay, what we see typically with a punch, one of the first areas to come in contact with the object that you hit is that fourth, is that fifth, the head of the metacarpals, those knuckles, and that causes a very, very common fracture in the fifth. All right, so that's a boxer's fracture. Other times we see traumatic fractures where you get lots of different cool, lots of different interesting fractures. This person, for whatever reason, decided to trim a hedge bush. And what they did, they picked up their push mower and were using that to trim the hedge bush, and the thumb got caught. And really pretty amazing that the thumb didn't get cut off. Now, phalangeal fractures. When we talk about metacarpal fractures, you'll see massive swelling, displacement, false joint, crepitus, very, very easy to diagnose. With phalange fractures, not as easy, okay? What we want to look for is alignment and contour. Notice how this middle finger is slightly rotated. They actually had a middle phalangeal fracture. Got this caught in a door. Finger dislocations. All right, if that phalange doesn't fracture, and sometimes with dislocations you might also have a fracture, but you can see different dislocations. Now, what happens with a finger dislocation? There's this normal structure, all right? So this is normal. This is called the volar plate. The volar plate acts kind of like this guide or bumpers that keeps the tendons that run to your fingertips in place. So as you flex your fingers, that flexor digitorum superficialis, flexor digitorum profundus, it's running to your fingers. This volar plate keeps it in place. When we have a finger dislocation, this volar plate ruptures, and now we see hypermobility. Okay, so anytime we have a finger dislocation, you're more than likely going to see a rupture, and we can see excess mobility in those finger joints. Now, jersey finger. All right, the next couple slides, these are all prominent hallmark finger deformities, okay? Jersey finger, we have a tear of that flexor digitorum profundus, okay? So flexor digitorum profundus tears, and it stops you from fully flexing your fingers. For whatever reason, and I'm not sure why, I apologize, but jersey finger is common in the fourth, or your ring finger. All right, that's the most common spot to have jersey finger. Typically, we see this, the finger gets caught, gets jammed, gets caught up and pulled away. That tendon causes an avulsion fracture, and it stops that finger from fully flexing. Okay, so fingers 2, 3, and 5 can all fully flex. Fourth gets stuck. With jersey finger, oftentimes you're going to splint, let it heal on its own. Mallet finger. Now we have a tear of the extensor tendon. So your finger's stuck in slight flexion. Very common, get hit by a ball or get your finger jammed. Boutonniere deformity. Now, that extensor tendon, rather than running over the top, there's been a tear, and that extensor slides down and pulls the finger together. Okay, so it kind of pulls that finger closer and causes this bridge. All right, we call that a boutonniere deformity. So nothing's really torn, it's just that tendon, rather than running up top, gets pulled to the side. Trigger finger. So that flexor digitorum superficialis or profundus, through overuse, it actually gets thick and kind of causes this nodule. And so what happens is, as it runs through that volar plate or through those tendon slips, it gets caught and it catches. Okay? Typically we see this only in the second. Dequervents. This is text thumb. Remember our snuff box. We have 2 tendons that share a sheath. We have 1 tendon that runs by its own. Here's the tendon sheath, and through use of the thumb and specific overuse, we see thickening, we see adhesions, we see fluid buildup, and so what we have is known as de Quervain syndrome. All right, what I want you to do is you're going to test yourself. You're going to put your thumb in your hand and collapse your fingers or close your fingers over it. And then I want you to ulnar deviate. So you're going to move your hand to your ulna. What you'll feel is pain, tightness, or stretching along that radius through the thumb. That means you have de Quervain's. Very, very common with texting. UCL injury of the thumb. Okay, this is also known as gamekeeper's or skier's thumb. But along the thumb, I'll jump ahead. There's a collateral ligament, we call it UCL of the thumb. When the thumb gets pulled away from the rest of the hand, that ligament can become torn. Think skiing, okay, holding the ski pole. The pole gets caught, pulls your thumb away, or maybe sliding into a base and your thumb gets pulled away. That can cause either a sprain or a tear of that UCL. This just leads to looseness or laxity in the thumb. Okay, so again, sometimes fixed surgically, but most of the time just putting a splint, allow the area to heal. So those were common, more acute type finger deformities, finger issues. These last couple, these are going to be long-term. So these would be chronic thumb, chronic finger, chronic hand issues that over time causes posturing. Dupuytren's contracture. This is your palmar fascia tightens and develops adhesions. The scary thing, it's hereditary. We're not sure why, but some people are more at risk. Where that palmar fascia tightens, it thickens, and it pulls the fourth and fifth into the hand. So your fourth and fifth fingers kind of come in towards your hand and they sit there. So no matter what the person does, those fingers just kind of get stuck in that position. Claw hand. If you have an injury to your median and ulnar nerve, your hand actually gets stuck in this position. Now, in the U.S., we see very few cases. All right, we have a fairly, right now, advanced medical system, so we don't get to the point where we have long-standing issues to median and ulnar nerve. In some third world countries, we see this more often, but again, it's median and ulnar nerve injury, which over time, months to even years, they waste away that intrinsic muscles and the hand just kind of curls up. Bishop's deformity is ulnar nerve. Okay, Bishop's is ulnar nerve. Now, fingers 3 through 5 flex and they curl in. With Bishop's, that person will have very, very little use of those fingers. And then lastly, ape hand is median nerve. Okay, so think carpal tunnel, don't address it. What the person will present with is this posture of ape hand. The thumb sits close to the second. They're not able to use their thumb. And that thenar eminence, so that fat pad under your thumb, wastes away. So that takes care of different finger deformities, different issues. That covers Chapter 17, Chapter 18. Again, a condensed version. Otherwise, that's all I've got for you. Have a great rest of your week. Take care, guys.